We're just going to have a panel discussion on the challenges and opportunities for prompt response systems going forward. You've met most of the panel already this morning. So Jess, Doumany from Research Lead at AIVL, Lucy and Cam, and also we have Jared Brown from New South Wales Health. He is the manager of the Toxicity Response, Epidemiology and Surveillance at the Centre for Alcohol and Other Drugs, also a great friend and contributor to the Prompt Response Network here in Australia, so very pleased to have him. I don't know if I'm game enough to sit down in the big red chair because something might happen, but I'll try it anyway. All right, so I suppose just to kind of get the conversation started, I was wondering if from the entire panel, from the presentations that we've had this morning, is there a key takeaway that you've had that you think that's new to you? So I think Jared's done the least amount of work today, so I might put him on the spot first. Have you got?
Something that was new to me. Well, I really enjoyed from Public Health Scotland seeing the transparency of the information that they're collecting and the rapidity of that. Having those data reports going out every 12 weeks is really kind of novel in this space and something that I definitely think in Australia we could look to emulate, particularly with the comprehensive nature of their reports and accepting that not everything needs to be perfect, which as a kind of someone from an epidemiology background kind of is a bit of a challenge, but kind of accepting some degree of uncertainty in the interest of getting the data out there, I think is really admirable.
Thanks, Jared. Jess, I might pop to you next.
Yeah, I suppose from a community perspective, I suppose sort of the snowball sort of face-to-face sort of knowledge sharing has been operating for some time, and I suppose what's new and exciting to me is that we're taking steps to actually access and formalize that, and I suppose navigating the nuance of that, for instance, confidentiality concerns, all of those sorts of things. But now that we sort of are on this path, the potential and excitement, that when we begin to navigate those issues, that the opportunities that that'll open up, for instance, to particular cohorts, and people in jail are one. That's another cohort. How do you negotiate the confidentiality of that? I think it's the start of an important conversation, an important avenue, whilst protecting the rights and interests of people who use drugs. But yeah, for their safety and well-being and betterment of the community. Yeah.
Well, thanks, Jess. Cam.
I think for me, I was very impressed with that the forecast that Jennifer showed from the 1980s. That was insane how accurate that was. It does show the importance of horizon scanning. If we had taken some steps back then, who knows where we'd be. I also really enjoyed Vicky's presentation as well around the anecdotal reporting. They're doing some really cool stuff out there, and I think we'd like to adopt some of that.
Finally, Lucy.
Yeah, I'm with Cam on the anecdotal reporting. Obviously, we have it on our website for people who use substances, but I'm really keen now after all this talking to expand it a little bit to some of those wider communities who also have information that they might be able to share. In giving them that portal, that means they don't have to email or call or know. Just building that relationship that way that's something we're taking home.
Thanks, Lucy.
Sorry, one more. Just on that, I thought it was really interesting how they feed back the anecdotal reporting back to the public. Something I've never really considered, but it's kind of a good way to lead by example. And you kind of show that information, is being taken into consideration, and then you get to put it back.
I think that's a really good point, and kind of leads into a little bit to what my next question was going to be, and to Jess, just about what are the kind of key actions government agencies can take to actually demonstrate that they're paying attention to and acting on the information that community supplies.
Extending on that, I think that as as a community-controlled sort of national body and sector, we're trying to do this. But I think a way in which government and mainstream can sort of respond back. It's providing that feedback, but also, I mean, for instance, in the community control sector at national, and particularly jurisdictional levels with Aboriginal medical services, there's been a particular sort of effort, especially in Queensland, to develop regional report cards for communities. And it's sort of that accountability and reporting back to communities, and I mean, if they are community controlled services and driven for the purpose of community, then community should have that information and to know how how their community is performing, what's being done to assist, how that information that they provide is used. And I think it does open opportunities, for instance, like regional report cards or state report cards. So there is that transparency, accountability, and it does show how people's input is being used for the betterment and improvement of their community and services responses.
Anybody else on the panel care to comment on that, about what are the key actions that we might be able to take to actively demonstrate that we're building credibility through kind of
just
respect?
an extension? I sort of don't know whether it sits within the first iteration of these or I think that's where the importance of community involvement is so important in terms of the scope and impact of service issues that do affect them, not just to do with the drug taking, but their interaction with that entire service continuum. Yep. And I feel like there would be positive space and potential perhaps to have, de-identified means to give feedback on their interaction with different stages and aspects of the service system to create that accountability and pushback.
Yeah. So the information is there and can be acted on. Mm.
We kind of sit on the other side, but one of the big things I think is really important is making sure that those community groups understand how you work, because it's really easy for them to feed in and then think you're not listening because you didn't react in the way they thought you would. But if your process means that you put it into the matrix and you did the thing and these are the steps I took. If they don't understand that, then they think you're not listening, even though you have listened and you have done action, but there wasn't an outcome that they saw. So that engagement, so they understand what's going on, is something we've had to work kind of almost with every, a new iteration. When we bring more people in, every single time we have to go through it again, because that reminder that if they don't know what you're doing, then they might not understand your why.
Yeah, so that transparency of process being really important for people to show that something has happened and there has been some respect there. All right, I might move on to a question just for Jared. Oh, lovely, thank you. Jared, what do you think might be the biggest opportunities for strengthening collaboration at a national level for prompt response systems in Australia?
So in Australia, there's a lot of goodwill, is what I observe. It's been a pleasure to be involved over the last kind of 5 years that I've been in my role and since the PRN's inception. And there is a lot of goodwill between the different jurisdictions, the different stakeholders that are part of the PRN, and I've seen that grow. And there has been some progress in terms of investments from the jurisdictions and from the Commonwealth around resourcing prompt response systems, but I think there is a lot of opportunity into the future for that investment to grow, because at the moment I do see a lot of people doing this as a passion project rather than a formally resourced system across the country, and that does make it challenging for it to serve to its fullest potential, such as something like that we see in New Zealand, where you've got a fully resourced team to act on the intelligence sources from a range of inputs. So, and then that kind of leads me into the next point that I'd have to say around the kind of siloing of information that we do see. There is a lot of data out there across Australia, even within existing data collections that would support our kind of drug surveillance and early warning systems. But a lot of that data isn't necessarily available in a timely enough manner to form actionable intelligence to kind of initiate a drug warning or a public health response. So I do see that we've got opportunities there around the kind of resourcing for these systems, as well as kind of breaking down the barriers between kind of these data silos that exist across within jurisdictions and between jurisdictions.
Thanks, Jared. And just also while we're thinking about resourcing, in Europe, they've just put a lot of funding into toxicology lab testing to support early warning systems. Where do you think we're up to in Australia in terms of our toxicological capacity?
I think Australia has some of the kind of leading labs in the world around kind of toxicology capabilities. And to do that, there's a lot of research investment that carries that on. But in terms of public health investment, that's quite variable across the jurisdictions. And we see agencies such as the EUDA and the CDC in the US, where there is actual resourcing behind lab development. And we also see the UNODC providing development resources for labs. But in Australia, a lot of that resource development for lab capacity is at the research level. Victoria, New South Wales and WA, to an extent, do provide some funding directly into their labs for public health capabilities around drug surveillance. But we could take a lesson from these other international examples of where really ensuring that the labs have the capacity to turn around testing in a public health response time frame. So not in a coronial time frame of where months might be okay, but within days to be able to respond to an emerging drug threat.
Thanks, Jared. I've got a couple of questions online that I think are for Cam and Lucy in particular. So Cleo Harper has asked, how does the New Zealand legislation for drug checking work for people providing a sample? Are they protected from prosecution?
Yes. And no. Drugs are still illegal in New Zealand. The possession of drugs is illegal, but the attendance at a drug checking clinic cannot be used in prosecution. So you are allowed to go and get your drugs checked when you take them home or go to a festival after that. All bets are off.
Thank you for that. The next question is from Christine Harvey, and this question I was going to have myself for Cam anyway, which was just what's the process that you follow when you're devising your drug notifications to make sure that you kind of maximize your relevance and reach? What are the key considerations that you've kind of learned in your time over there?
Well, I kind of spoke to some of them in the presentation, so might speak to a couple others. I guess a big one is keeping it simple. All the information that's contained in an alert and notification, it really should earn its place. We don't need to, show how smart we are. We just need to make sure that the right information gets there. I guess the other thing is thinking about your angle or your hook. You may only have a minute to hook someone in, so you want the most important information up front. So it's kind of something we operate in intelligence. We do. It's called bluff or bottom line up front. So you want the key information up there straight away. Try to hook that person in, and then hopefully they read the whole thing. But we know a lot of people are time poor or attention poor. So
Can't read.
Yeah, no, it's a good point.
I used to take mathematics support and couldn't read. So.
It is honestly something I've never considered. So again, if you get images out there, things like that.
So images. Did you want to speak a little bit more about, just from a consumer perspective, about getting those communication rights? What are the key things?
Yeah, I was just saying, like I've had a couple different mates who I've had to literally go to all their court and parole appointments because they can't read.
Yeah.
You think, you apply that to sort of there's sort of more than one case of that, across the community in drug using cohorts, and think about that with getting warnings out. Yeah, it sort of does encourage sort of manifold ways of getting information out.
So we are quite dependent on text-based ways of messaging.
Yeah, well, in that case, those people are very much dependent on the verbal sort of face-to-face transmission of information. Yeah, because you don't really get any sort of other form of warnings other than text-based.
Yeah, and then I suppose that would support a very community-engaged way of actually getting messaging out in a way that's effective. It needs to go through community, which also speaks to that credibility. Yeah. Jared, do you have, from your kind of New South Wales experience, what do you think are the important things to get right that we sometimes don't?
It's always a hard balance in terms of getting too much information versus too little information. There's a lot of feedback saying, "Oh, we want to know more," but we know to keep it kind of to the fundamentals on the main alert, and then having a link through to more information is the approach that we would generally adopt. But the key thing that I'd like to kind of bring home is really working with kind of people with lived and living experience in designing the content and getting them involved in the development of the content. And we work very closely with Newer and, where relevant, other community organisations, depending on what the target audience is, to really make sure that the message is as best as we can to kind of reach who we're trying to reach. But having said that, ours are a government-based alert, so sometimes we can't say everything that we'd want to say. So making sure that the kind of peer organisations have enough of the supporting background information to help design their own messages, and helping to support them in developing messages in the formats that are probably the most catchy. So yeah, acknowledging that there's other organisations that sometimes will resonate much better than New South Wales Health.
In just on that, do you do any work with Aboriginal organisations to have warnings published in language?
Yeah, not at this point. Like, we do share our warnings with kind of various Aboriginal organisations to help propagate it, but and where we have had a couple of issues where they have particularly affected Aboriginal communities, we've worked much more closely with making sure that the messaging is more targeted, but no, not in terms of language, adjusting it in that way at this point.
There's another question kind of feeding on from that about any other ideas about information dissemination that's less technically connected, so it's, to low threshold supervised injection facilities, for instance. It is an interesting question to think about this afternoon. We have a focus on technological innovation, but sometimes maybe
sort of, operating at the grassroots.
I think so. People that are less technologically connected is the question. So, however you want to interpret it.
I suppose when I sort of reflect back to, I guess, in regional areas and cohorts, I guess you're just purely relying on your street-based, word of mouth and other users, and that's about it. In some, I suppose Nimbin is a sort of different community, and that's a bit more forward-thinking than the neighbourhood centre provides a massive role that, say, usually a health or social service might play, and they actually have naloxone and things like that, things which community centres don't usually have. They've really sort of worked to tailor that to their community, but I suppose we don't have injecting rooms as such, but that in those sorts of instances, you're really dependent on your user-to-user sort of information sharing, I find.
So in New South Wales, I guess some of the ways that we try to address that would be through the NSPs and the kind of injecting centre in Sydney, and that is they do print out the alerts and put them up for people and do discuss it with clients that come in, as well as kind of more recently through Newer, kind of using the peer distributor network to kind of get the message out into the community and in their outreach services that they provide. So that's some of the ways, but there's definitely kind of further room to grow to make sure we get out to the kind of the whole community.
Thanks. I might see if there's any questions in the room. If we've got one over there.
Hi. Oh, Jesus Christ. Just speaking of NSPs and printing out stuff, we're from the Redfern NSP, run by New South Wales Health. So we're the harm reduction program. And I think that's a really good point in terms of, I don't think New South Wales Health is doing enough in terms of working with peers and working with people who use. I mean, I don't know, like me and Sue, like I just get the drug notifications and just no one's told me to. I just give them out to people, have conversations with people. But there's no policy about that. There's no like practice. It's not actually embedded in any of the systems. And so it just takes people who just happen to have like a harm reduction philosophy, the way they go about their job for that to actually happen. And I think it's so interesting with the sort of aiming so high with technology, and it's interesting as well that in New Zealand it's done by the intelligence agency, when I see it as a real like public health and public policy response that when you are designing any initiative, you have to really design it with accessibility first. Otherwise, you have all this fancy stuff and it doesn't reach anyone. It doesn't actually matter what you've done. You have to design it for like sort of the lowest common denominator of access. And we see people every day that probably of our like 80 clients in our client list of people we see all the time, they don't have phones. They like probably over half of my clients are homeless. Like they like either lose or hawk their phone. Every time I see them, I have someone in my phone, like a new phone number November, new phone number December, so I just really want your perspectives on that, if that's okay.
Yes, there's a lot there. I think so. I think there should be lots of things for people to respond to. But for me, it was that really there's no technological replacement for a personal connection. And so services like yours are really key for that.
I think, you make a really good point. I know various people who've it's just like a rotating round of phones, and it's sort of not really something they interact with for information as such. It's very much a get on device. But and also, people just in those contexts are also aware of how much they use that phone, what they say on that phone. It's often quite disposable, or they lose it, or But I mean, if you're talking about like holistic well-being as well, I suppose people who are lacking, literacy and communication skills, they're often the people worst persecuted by the justice system because they can't express themselves. They actually don't even know what they're being charged with. I think it's not just the safety aspects, but there's many aspects, I suppose, where that information translation process and actual one-on-one communication is really important. And it has massive connotations, not just health-wise, but across the social determinants of health. How much actually someone, and, it can be a shame factor for someone saying, hey, I can't read or write, and certainly in a courthouse where there's a power dynamic, it can be hard to put, as well. And certainly if you can't actually interpret what you're being charged with, or, it makes it really difficult and it means that, I think New South Wales has only just introduced something as well where legal aid won't support you unless you're facing jail time. And that makes it really hard for some people. And, that's an extension of the damages, caused by, I suppose, by interaction. It's, the long-term impacts of incarceration, and then the to and fro that can create. They're all public health issues, and I think that there's a lot can be done in terms of adapting and innovating technology to make it more accessible, regardless if you can read or write. I think that's really important. Just on a public health front, not just physical health. But,
Anyone else?
One of the things we do value and think is really important is, while we may be the source of information going out from the bubble, like what I refer to as the phone tree situation is actually something we really do support. So our notifications with our one pages, that's that conversation about print these out, talk to your people, however you're having conversations, do it. But then it also comes back to that whole thing about people don't talk about drugs half as much as they should for the amount that they're taking. And anything we can do to kind of reduce that stigma, even to have those conversations, is like a starting point in that too. So just talking about drugs as much as you can. That's what Cam and I do.
I think having those peer identified roles too to do that, because there's always a different dynamic in talking, I guess, for someone who uses drugs to someone who doesn't use drugs and to someone who does as well. And I think that's where, having peers to sort of know, and to elicit those issues sometimes without that person having to say, it can just be a bit more of a gentle sort of flowful process.
Thanks. I'd also noting as well, just we've got the community.theknow.org.au and that's for people who are working in the sector to keep themselves upskilled. So everybody here should be registered in that so they can get that information to have those conversations in those workplaces.
Oh, sorry, Brandon. Just on that point, I think it's a really good thought. Sometimes we do get ahead of ourselves, and we like to look at the the tech, the fancy stuff. But if we're not doing the basics, if we don't have a foundation, the whole thing can fall over quite easily.
Thanks, Cam. Yeah.
And one more, because you set a mission for New South Wales Health there. Thank you. Thank you for bringing that up in terms of equipping NSPs to kind of know what to do with the drug warnings. It's a good point. Like, we don't have a toolkit to support the implementation in terms of those services to know how to kind of implement them into practice, and that's something that we can do better in. And the engagement with the NSPs is something in the last 12 months that we've starting to engage further, working with the NSP leadership group of how we can both kind of help support the NSPs better in terms of sharing kind of drug intelligence information to support those conversations with clients. But equally so, there's so much valuable information that you're hearing, providing services to clients of how we can incorporate that information back into understanding what's going on in the community. So thanks for bringing it up, and we'll continue to work together more closely.
And just in case that's not enough work for you, Jared, I think those conversations aren't just NSPs, they're also drug and alcohol services and emergency departments, because I think if I reflect on some of the workplaces I've been in, we probably don't have robust ways of ensuring accountability for that information being shared. Any other questions in the room? Yes.
Hi, I just want to address the opposite of what was just discussed there in terms of, maybe more younger people or those who don't use drugs as frequently, who maybe only looking at it in terms of like going out when they party or festivals. Lucy and Cam, you spoke about the, your reach on social media earlier. Again, bearing in mind what was just discussed then, but how important is that social media connection to getting that message across? Not just to those who may or may not be using directly, but even just their friendship networks and communities.
I think those peer networks are so important, and social media is kind of the easy way to get it out there. We do see it a number of times where we put out a notification or alert, but that's already circulated peer groups, or maybe even be mum or dad sending it through to people. So it's something we don't want to overlook that.
Lucy?
I think for the particular population you're talking about, like, social media is 100% the way they're communicating with their friends. So anything we can do to get ourselves out there in that way, that's why we're always thankful for whoever the friendly member of the public is who shares our notifications onto Reddit every single time. Gets into, by having it that way, it gets into some of those quirky parts of the community internets that we wouldn't normally push into because that's not quite our place. But once again, it's a different kind of peer to peer, but it's still peers supporting each other. And yeah, so however communities can work together is really important.
Jess?
I was going to say, having the presence of like dance wise and different community drug action teams at festivals for that sort of face to face, I think is also really important, because it's also, I find, that younger cohort where there used to be sort of, I suppose, before all of this, like it was your older cohort that you sort of learnt things from. And I find that the festival, it's sort of, when you've, I suppose, it does sort of attract a younger cohort who might more casually take their drugs, but with that can sometimes come a lack of knowledge around certain things. And I think that's where that peer presence is so important. Like, for instance, I think it was Rainbow Serpent 3 or 4 years ago, a young kid drank a bottle of amyl nitrate and literally killed himself, just liquefied his insides. And, knowing what drugs are, how to take them is really important in that context, and especially for people who do casually take drugs. And so I think regardless of what the warnings are, having peers there who can actually explain, well, that's what that is, and this is what this is, and that's how, if you're going to take it, this is how, I think it is really important, because regardless of what something is and whether it's in its pure form, if you don't know how to take or interact with that, that's a problem.
Just on that, in that discussion, so I don't know what it's like in Australia, but our drug checking services did a study slightly before it was all legal, and then they've been doing it still, that 90% of the people who attend drug checking services don't engage with any other drug harm reduction service. So these people are not getting information from anywhere else except possibly the internet, which has good places and bad places to be getting information.
Thanks, Lucy. I think we've had a couple of questions around drug checking in New Zealand. I was wondering, are you able to, having been engaged with drug checking for 4 or 5 years now, what are kind of the lessons that you've kind of gained from integrating drug checking into drug notifications like alerts and warnings?
I mean, it's essential for what we do. Besides one very small incident at the border, the first nitizens we saw in our country were seen at a drug checking clinic before anything else. We see that with NPS all the time, to a point that it's a bit, you would think there would be other steps in our path that you would see these things first, but it's not. It's with a person who might take it. And so it's been so essential. Then 50% of our notifications come from that. It's what Cam talked about in our presentation. It's that being able to get ahead of it as opposed to reacting to harm that's already happened. I honestly don't know if we would be as like what we are without our drug checking services. This is my plug. We're always here to support any community who needs someone to write a to argue for drug checking. Drug checking supports not just High Alert, but some of the other work we do in our wider team, which I don't know if everyone really thinks about. So yeah, we're all 100% in.
Have there been any challenges that you've had to overcome that you think might be good for Australian agencies about to undertake such?
I think the drug checkers know what they're doing. A lot of these community groups kind of already exist before it may be 100% black and white legal. So supporting them in that way is just really important. And also, Cam will tell the story. For us, one of the things we do, and one of the things we will deal with over the summer, is reminding police officers to stay away from drug checking clinics. They all know they're not meant to be there. They're also just really nosy because, once again, no one talks about drugs. And they're curious too. They're people who want to know about this harm reduction service. So for us, that's one of the things that we do, is just reminding them that if they're in their uniform, they probably shouldn't be nearby. Yeah. Because they know that they have no power in that situation. The drug checkers know they have no power in that situation. And some of the people using the service know, but it's still just not a great look. So
It's not a- yeah.
Sudden NSP won't see the paddy wagon.
yeah. So it's just that building and engagement again.
All right, to kind of close the session, we've talked about a little bit around how personal connection can't be replaced by technology, but I was just wondering about the panel's views on what hopes they might have about how existing and emerging technologies could be used going forward in developing better, more prompt response systems for emerging drugs. Does anybody want to go first? Oh, Jess will.
Oh, sorry. Wrong, right? Oh, look, I just think we can only benefit from having people, who use and are at the forefront of, on the ground. But we ultimately, it's the optimum way of getting a full picture of what's happening and like Jack was saying, being able to triangulate, all the different information sources that we have. But I also think it's this necessary starting point to sort of build that trust and rapport and sort of reciprocity of information sharing. And my hopes too are that it creates a safe and de-identified mechanism for people who use drugs to push back on the service system too, and there's a broad continuum at which people who use drugs can enter and exit the system, and sort of it's my aspiration that that's a safe journey no matter at what point that they do that. And I really hope that sort of this can sort of help create not just a more accessible and safe and appropriate system environment, but build trust and I guess a culture of knowledge sharing between mainstream and the community and users, where it ultimately contributes to the health and well-being of our community.
Thanks, Jess. It can be about ChatGPT, it's fine. Ed will want us to talk about AI in some regard.
I want to say AI.
Okay, you go next, Cam.
I don't think I'm smart enough, though, to see where it actually end up. My first thought was around NPS and, I don't know, somehow using AI to kind of predict what we may see, I guess, over the horizon. But I think it's important not to get ahead of ourselves. We don't want to skip steps, so we really should try to exhaust everything we have now, and then kind of introduce technology as it comes out.
Lucy?
I think I'm very much kind of on the same vein of what Cam just said, that all the technology in the world isn't going to save you if you don't have, processes in place to be able to reach people. Do you need a website or a Facebook group or or whatever that way is? So I think technology can help us, and the amount of time I spend on my computer every day kind of says it does. But getting ahead of yourself is, like as Cam said, is probably something to be very aware of. Are you just trying to do bigger and better for bigger and better's sake?
Jared?
So for technology, I think I've got two quick thoughts. So technology around kind of analytical capabilities is expanding rapidly, and the fact that we can get more rapid analysis, more field-based analysis with more certainty and sensitivity in terms of what we can detect, that's got real opportunities in terms of more rapid identification of emerging substances. And then secondly, I don't think anything can really replace all of the kind of the human connections of what people are talking about. But because of social media, a lot of those conversations are now online, and I really think there's some lessons to learn and evolve around those communities and the narrative that's happening online. And we've had examples of that in Australia with kind of Reddit forums around when we had the issues with the toxic poppy seeds. Some of the early signs were actually out there on the web, and people were talking about it in these forums, and it was kind of missed. There's no one monitoring those forums, or there's limited people monitoring those to actually kind of bring that information back in to be used for our kind of public health system. So I really think there's some more to do around, but with those protection of privacy, like I don't want it to be monitoring for the sake of monitoring to kind of for any prosecution or anything from privacy point of view, but really identifying signals that we can act on that will reduce harms.
Lovely. Thank you. I think we're at time now, Gemma. So I just really want to thank the panel for a really interesting discussion and for bringing all of your perspectives and knowledges to it. It's been very appreciated, and hopefully you will be able to have some very nice coffee and some treats now. I think we've got afternoon tea, and if you will join me in just giving a round of applause to our panel, and then meet us back here at 10:00.